Dr. Berwick, thank you for your distinguished service and your candor this morning. We know that an earlier generation of Republicans fought Lyndon Johnson in getting Medicare created in the first place with the same fervor that our Republican colleagues are fighting health insurance reform today. We know that Newt Gingrich was determined to let Medicare wither on the vine and had the support of some of the Republicans who continue to serve on this committee. And now they have laid out a roadmap. You've discussed it with Dr. McDermott, where their ultimate goal is to move seniors to the uncertainty of vouchers, away from the guarantees that Lyndon Johnson signed into law in Medicare, and to shift responsibility to seniors to meet their health care needs, to fend for themselves with private insurance companies to provide for their needs. That's the longer-term goal. But in the short-term goal, it's become increasingly apparent when you cut through all of their repeal rhetoric that what they are really presenting to seniors and individuals with disabilities is a plan to increase the cost of their health care. And I'd like to go through and itemize how this Republican plan will increase the cost of health care for seniors and individuals with disabilities who rely on Medicare. Under existing law that you administer today, if a senior needs a mammogram, colorectal cancer screening, bone mass measurement, will they have to make any copay?
Not as we implement the law.
And so if we repeal that guarantee of no copayment, seniors will have to pay more
if they
for those services. Their health care cost under the Republican plan will increase, will they not?
For those services, yes.
Let's discuss the effect of seniors and the increased cost that Republicans want to impose on them right now with the bill that they have already passed with reference to prescription drugs. The estimate, best estimate I've seen through the Assistant Secretary for Planning and Evaluation, and I would ask you about this, is that the average individual who would reach this donut hole gap in coverage, a gap in coverage created by the Republicans with their prescription drug plan a few years back, that when they reach that gap today in 2011, each of those people on average will get a little over $500 in benefits under existing law, total benefits to Medicare beneficiaries of about $2 billion in savings this year under the law. Does that sound about right?
That's correct, and we get to 2019.
And so what the Republicans are proposing in repealing that law is to hike the cost for prescription drugs to seniors in America this year by over $2 billion, over $500 a piece for those who enter the prescription drug gap. And you discussed this with Mr. Lewis, but do you have a mechanism under their increased health care bill to demand of seniors that they give back the $250 that we gave them through this bill last year for prescription drugs? About 3 million people, you said?
Yes.
Is there any mechanism there?
I hope we don't have to.
Because I assume under their repeal bill, we're going to be asking seniors not only to pay more this year, but to give back the $250 that they received if they reached that gap last year. Now, what about on the issue of the Part B premium that we ask seniors and individuals with disabilities to pay? Under existing law, according to all the estimates you've seen, won't those premiums be lower than if we adopt the Republican higher senior cost bill? Won't those seniors have to pay more for the Part B premium if Republicans are successful in their attack on Medicare?
Yes, I believe they would.
And with reference to Mr. Camp's assertion that some Part D premiums could go up for seniors, that's true only to the extent that they get more coverage under this bill, isn't it?
Yes, they have a selection.
And any increase is really fairly modest. And finally, with reference to the Medicare argument that our seniors are going to lose the ability to select their own doctor, there are actually incentives under the law that they want to repeal to pay our primary care doctors more under Medicare than they have received at any time in the history of Medicare. Isn't that right?
That is correct.
And that ought to give seniors not only lower health care costs, but more choice than they have ever enjoyed in the history of Medicare. Don't you agree?
I agree.
Thank you so much for your service and for your candid answers. I hope that we can work together to ensure that this Republican plan to eventually privatize Medicare through a voucher system, but in the meantime, this year, to hike costs to every senior and individual with disabilities who relies on the Medicare system, that plan, they can call it repeal, they can call it an attack on President Obama, whatever they want to, but we have to stop this Republican plan to increase seniors' cost.